So we can ask the alternatives in the grafting section and see the advantages and of the synthetic bone grafts. So when we see the clinical applications in dental field, we see that autografts, which are the patient's own bone tissue, we can tell it as a gold standard. Allografts, these are unprocessed or processed allogenic bone. It is with a surgically received from a cadaver and process it. And xenografts, these are animal-derived bone substitutes, mainly based on collagen and gelatin. And also synthetic bone substitutes, these are mainly based on the bioceramics, specifically beta-3 calcium phosphate and hydroxyapatite. These are the main bone graft substitutes in the clinical applications. Among these alternatives, let's look into the why we need to select the synthetic grafts. So when we look at the limitations of autografts, allografts, and xenografts, we can tell that autografts, it requires additional surgical procedure. So you either need to isolate the graft from the defect side or in the other side of the body, which is not like there is currently no defect on it. You have to isolate the bone tissue from there. So you are creating another problem while trying to solve one. So donor site morbidity issue is a fundamental drawback of the autograft usage. So definitely this is limited supply. You can't go for the larger defects to fill the larger defects. And it will increase the surgery time. And when the time increases, the infection risk also increases significantly. When we look at the allografts, main problem comes from the immune rejection, because a graft material that bears a foreign protein inside definitely has a chance to alert the patient's own immune system. That will create a problem of rejection of the implanted graft, and it will delay definitely the bone regeneration. Another important drawback is disease transmission. So although these are being tested in many times before transferring to clinical application, but there's still risk. And there are cases identified in France and Germany that caused by the allografts that are created immunogenic alert reactions and also disease transmissions. So in terms of mechanical strength, also after sterilization of these allografts, mechanically the strength is decreasing. So when we look at the xenografts, we can see that the immune rejection risk even higher in the xenografts, because inside this collagen, if it is not adequately degenerated, the collagen as it is as a large molecule, it can create immune reaction. And slow integration, because of the slow resorption time of the animal hydroxyapatite, it will be obviously, it will not allow space for patient's own bone regeneration. The bone can be integrated, but never like the regeneration wise, replacing the patient's own bone with the graft molecules is gonna take over like 15 months to 18 months, even longer. So this is also a problem. Also in the regions that are taking it important of like this animal-based materials usage, ethical and religious concerns might be also an important drawbacks. So when we look at these drawbacks in general, the alternative graft materials, and we turn back and to look at the synthetic grafts advantages, and we can tell that you're overcoming those risks. At the same time, you're adding advantages and the clinical and manufacturability advantages. So the first one would be like availability and consistency. So it's a highly pure chemicals use process of manufacturing. So this is availability of the graft is not rely on any donor, any surgical procedure. It's only matter of time and manufacturing process. So you keep using the highest grade chemicals and less toxic elements in it, like continuously you are getting consistent products, and you would never consider based on any donor change, you would change the product quality would change. In synthetic grafts, it never happens. So you don't have any donor site morbidity. You don't isolate any graft molecule from the donor. Reduce risk of disease transmission. It's a controlled process of manufacturing. So you will never have any influence outside because it's a protected environment of the manufacturing. And you know the highest grade of chemicals used in the manufacturing. The fourth one is biocompatibility and customization. Since the used all ingredients are biocompatible structures, so you can create reach to continuous biocompatibility in your synthetic grafts. You can, since you have all the control in manufacturing and selection of the raw materials, main materials, you can control osteoconductivity and osteoinductivity properties. Just briefly, osteoconductivity is the term that the graft molecules acts as a three-dimensional support during the regeneration of bone tissue. Osteoinductive is, while serving as a three-dimensional graft in the defect side, graft molecules also accelerating bone regeneration in the osteoinductive characteristics. With the small changes in your molecular formulation, with an based on the fundamental scientific facts, you can reach the osteoinductive properties. So also, like the sixth one is the faster healing. When you add these osteoinductive characteristics into your synthetic graft molecules, not only your graft molecule serves as a three-dimensional support during regeneration, but also it's gonna stimulate bone regeneration, and it is gonna fasten the process of healing. It will be better for the clinician. It will be better for the patient, definitely. So based on these facts, that known facts in the field of bone grafts usage, specifically in dental field, we had our guideline in like, okay, we have to reach osteoconductive we have to have osteoconductive characteristics, definitely, because our graft molecules needs to serve in three-dimensional during the regeneration process, but at the same time, with the key formulation, molecular formulation, we have to have osteoinductivity to fasten the bone regeneration. So our motto was more bone in less time. So in clinical perspective, we're gonna see regeneration in faster time period. So we set our goal in that regard and did our research in to set our molecular formation. In this regard, osteoconductivity, in terms of set the regeneration process adequately, beta-3 calcium phosphate is a great alternative. First, what beta-3 calcium phosphate is considered among the other bioceramics is one of the partial osteoinductivity characteristics of bioceramics. Why? Because resorption time of beta-3 calcium phosphate is faster than hydroxyapatite. So during the bone regeneration period, which is like conducted in 6 to 9 months maximum, so the degradation molecules of beta-TCP, which are calcium phosphate ions, they are being used by the bone-making cells, mesenchymal stem cells, while their process of mineralizing the bone tissue. So basically, the graft tissue's resorption molecules are also being used by the cells that tries to regenerate the bone tissue. And also the degradation profile of beta-3 calcium phosphate was like readily set our goals, which was like 6 to 9 months of regeneration period is gonna be replaced by the patient's own tissue, because we didn't want to have integrated of implanted graft material into the patient's own bone. We want the graft material being replaced by the patient's own bone, because as we all know, the best bone is the patient's own bone in mechanically, in biologically. So when it is replaced, that is the best clinical scenario. So we set beta-3 calcium phosphate as a main material in the graft design. But biological influence wise, beta-3 calcium phosphate is not that osteoinductive. So that's why we added 1 mass weight % of silicate in our molecular formulation, and to enhance the regeneration of bone. I'll show in the slides. And the first, why we are adding this silicon dioxide silicate into the graft material? What would be the purpose of it? So originally, the calcium phosphate based synthetic grafts, beta-3 calcium phosphate is also calcium phosphate based. It's not negatively charged. So as we know, the implanted area of bone grafts are going to be introduced with the blood, right? So inside the blood, we have positively charged extracellular matrix proteins. So with silicate addition, what we achieved was we increased the negative charge on the surface of the graft material. So this negative charge basically integrate ionically binded of positively charged extracellular matrix proteins of fibronectin and laminin. So why it is important? Why this ionic binding is important? So we are only the guidance. So we try to guide the cells. Cells know what to do. As long as you guide them in a great environment, you supply them their nutrition and oxygen to survive and do their function, they can do the regeneration of the bone. But they want to be safe. So the cells continuously explore the surface of the graft materials. Cells on their surfaces, they have integrin molecules on the cell membrane there. They have integrin molecules. These integrin molecules function is to explore the surface of the materials. So definitely they're going to explore the graft surface. So when they explore the graft surface by their integrin molecules, what they're going to recognize is their laminin and fibronectin proteins. These proteins functions in the extracellular matrix of bone tissue is to recognize by the cells, and cells, when they recognize by their integrin molecules these proteins, they just bind to the surface of the graft material. So they say this is a safe environment. I can attach. I know these molecules. These are my cells. These are my known environment. So they attach. So in the first stage of the grafting, the more the cells adhere on the surface of the graft, then the proliferation wise, you're going to have more cells in the defined time frame. So these more cells are going to create more bone tissue in the faster time. So that's the functional point of silicate. And this is how silicate addition brings osteoinductivity to the Powerbone branded bone graft biomaterials. So with that molecular formulation, what we achieve is higher cellular adhesion and proliferation of mesenchymal stem cells and osteoblasts on silicate additive bone grafts, faster micro and macro bone regeneration, and patient comfort due to the accelerated osseointegration time. We know this is an aesthetic issue as well. If the clinician wants to wait for the bones to regenerate before the implantation, then there is like time never flies. So patients every day they look to the mirror and see there's no teeth. So this is a main problem. The faster the regeneration, the better the for patients and for the clinicians. So, and these scientific facts, we knew that this is gonna be turn out the numbers, economical values. Okay, this is not exact subject of the webinar, but I would like to show it because this turnover, like the motivation turnover to the scientifically to synthetic bone grafts also applies on the numbers. When you look at that, already in 2023, for dental applications, synthetic bone graft usage is reached to 26.7%. As you know, allografts and xenografts used to be dominating in the field, but when you see now is 26% already covered by synthetic graft application. And when you see the number over this, more interesting, the annual increase rate of the usage of synthetic grafts is significantly higher than the rest of xenograft and allograft usage, which is 10.6% every year, synthetic graft molecules, substitutes being used more and more. So these numbers also proving the scientific facts and the translation of synthetic graft usage instead of the alternatives is being continuously occurring in the field of dentistry. So in the webinar content today, we're going to cover 3 of our products in clinical results. So I will briefly discuss specifications of those 3 products, and our key opinion leaders, they're going to discuss the clinical results. So the products that we'll be discussing is dental putty, flexible graft, and the granules, as I circled in the slide here. So when we look at the granules and crunch, this is mainly based on silicate additive beta-3 calcium phosphate. Since these graft materials are being used clinically in a long-term profile, there are standards. There are strictly product-based standards. So you cannot be like synthesized beta TCP and here is my graft. So you have to obey the standards, and standards has a lot of characteristics test. So ASTM 1088 is a standard for beta-3 calcium phosphate based graft materials. So based on that, the purity of the beta TCP has to be over 95% in every single lot that you manufacture. So in our characterization results, we can confirm that our purity is over 98% in every case. So we have different sizes for dental applications, 0.25 to 1, 0.5 to 1, 1 to 2 millimeter is applied for the dental applications. So total porosity, interconnective pores, macro and micro porosity balance is very important because bone is a vascular tissue. You have to continuously support vascular formation. So this porosity is very important. And the bone regeneration is not only occurred on the surface of the graft, it is 3-dimensional. So you have to have your cells migrate inside the graft material. So you have to have in the macro and micro pores, and at the same time, interconnectivity in these pores. Mechanically, these grafts has to be durable enough to protect this 3-dimensional tissue support in the defect side. So based on the ISO 5833, we have adequate mechanical strength in the granules. So the next product is dental putty, is one of our mostly demanded product in dental applications. Is based on, again, silicated beta-3 calcium phosphate and semi-synthetic polymeric based gel that can allow it to be injectable and moldable. So it's a premixed material. The surgeon in the surgery room, a lot of stress they have to deal with. We know that. And it's a complicated process, implantation, a lot of parts. So never needs to worry about mixing the graft material. It's ready to use. It's already mixed. So just open the cap and inject into the defect sites. So it allows surgeons ease users. It's a radio opaque characteristics. It has interconnective pores and enhance osteoinductive efficacy. It's not setting right away as some of the alternatives in the as putty alternatives in the clinics. It allows surgeon to manipulate and arrange the defect site adequately. So around 10 to 12 minutes it sets, and then the defect site can be closed. In the animal tests, we also can confirm that putty and granule, when it is implanted into the muscle tissue, so for osteoid formation in the muscle tissue, the material, the graft material has to have a osteoinductive characteristics. Otherwise, it won't have any osteoid formation. When we analyze the histological results of our product, dental putty and granules, when it is implanted into muscle tissue, we can confirm that there is osteoid formation in the muscle tissue. So that is another confirmation of osteoinductive characteristics of Powerbone based bone graft materials. The third product is the flexible bone graft. As you see in the image, it can be bended, it can be cut, it can be rolled. So it's a porous structure graft material, and it is composed of silicated beta TCP and biomedical grade polylactide cocaprolactone. Dr. Minas is going to discuss about the usage of in lateral soft tissue augmentation of the flexible graft in the dental applications.